And this is about as good as the stria ever get on the skin lesions. I love to lecture to dermatologists because our stria are bigger than theirs. But whether or not you're a histopathologist or in the clinical arena, we've all come to recognize this pattern of lichen planus. There's a number of clinical subtypes. This is the most common and most characteristic. This is the reticular or striate pattern, where we get the little Wickham stria interlacing, usually bilaterally symmetrically on the buccal mucosa. And as far as I'm concerned, not really a diagnostic problem when they're this characteristic. Usually somewhat bilaterally symmetrical and very, very typical. For those of us on the clinical side, and I did see clinical patients for about 25 years managing these, it's the erosive form of the disease that produces symptoms, and patients then do seek out a specialist who can diagnose and help manage that. And they will develop areas of redness and or ulceration in these lesions, and then they evolve from the reticular to the symptomatic form. And this does adversely affect the quality of life for a lot of our patients. So this is a big deal for them. They really want someone to diagnose and to manage this. The first one was pretty characteristic to me. This one was not. I'd have a much more extensive differential diagnosis here. Maybe a little bit of striate here. This was biopsy. This was lichen planus, but it's got an unbelievable spectrum or range of the clinical features of this. There's some rare clinical forms. There's a plaque-like form. There's a papular form. Many of our colleagues today are going to be in India or Asia. You'll probably see a lot more of the pigmented lichen planus than we do in our country. I personally don't believe there's a bullous form. I believe bullous lichen planus represents two things: either lichen planus pemphigoides, where you do then get the blistering, or as superficial mucoceles occurring in a background of lichen planus. But that's in our literature. But you're not going to see this as a vesiculobullous process with any frequency.